So welcome to those of you coming into the webinar. As often happens at the very start of these things, we just like to give people a minute or two to find their way into the meeting. So if you haven't already, got yourself a water or a warm drink if you fancy that. Please make sure you're in a comfortable place where you can listen. And we have with us a fantastic guest speaker today, Adele Hugg. I'll formally introduce Adele in a moment. This is just the patter while we let everyone into the room. I'll keep an eye on that lobby. All right. So let me formally open our nutrition webinar topic 1. The topic for this first nutrition webinar with Adele is pre-habilitation, preparing for breast cancer treatment. As we begin our meeting, it's always appropriate to acknowledge the lands that we're on, the traditional owners of these lands. I'm streaming here from Whadjuk Noongar Boodja in Boorloo, Perth. Wherever you are, I invite you to also acknowledge the traditional owners of the lands that you're on. And together we offer our humblest respects to the memory of elders past, to the current generations of elders, and those emerging in future generations. It's an honour and a privilege to work and live on these lands. Now let me introduce our speaker for the day. Adele Hugg is an accredited practicing dietitian and she's a specialist oncology dietitian. She has a broad experience working in areas such as digital health, in hospitals and treatment centres. She's also worked as a freelance dietitian and in food service and the not-for-profit charity sector. Adele has spent most of her career in the UK, but she's a Perth girl and she's home, settling back into life in Western Australia. Nutrition is such a common area that we get asked questions about here at Breast Cancer Care WA, and there's lots of myths and curly questions that might arise. What we encourage you to do during this webinar, you can't speak, you're naturally muted because it's webinar style, but you should be able to navigate to the Q&A box. So if you hover your mouse probably along the top, but maybe the bottom of your screen, depending how it's set out, there's a Q&A section. If you tap on that, you can write your questions in, and we invite you to do that anytime during the webinar. Because Adele's so passionate about supporting people and their loved ones before, during and after breast cancer, she's going to answer those questions and give you the most up-to-date evidence-based nutrition advice that's relevant to these situations generally. It's not personalised advice. You'll need to have a consult for that, but it's broad and general, and I think it's going to be really, really interesting. So with that all said, I'm handing you over to Adele Hugg.
Lovely. Thank you so much. Now let's share screens and I'll pop this into presentation mode. Perfect. Okay, lovely. So thank you very much for the introduction and thank you so much for inviting me. I was really thrilled to be invited to speak for Breast Cancer Care WA. As Chandrika said, I do have a really broad experience and I'll go into some of that information in a moment. But before we get started, obviously the session today is about preparing for breast cancer treatment and something that's termed pre-hab. So I'm not really sure if you will have heard of that, but it's quite a new term. It's been around for sort of, about 10 years in some of the evidence, but it's really come into our practice within the last 5 years. And I'm going to use this session today to go through what prehab is and how we can implement it into your daily life. And also really keen to answer any questions that you might have. So what I will do, here's the session outset. We're going to be talking about prehab and the principles of prehab, why prehab is beneficial, what are some of the top tips and what it means to you, and then end with a fact or fiction. Now, I have quite a few questions that were submitted to me beforehand. And as Chandrika mentioned, this is the first webinar, but there's actually going to be 4. So I'm super excited to be able to divvy up sort of this information into sort of some pocket size, session size information to hopefully help you along your own journey. So there might be a time where I might say, actually, I'm going to cover that in the next session in a lot of detail. So we'll focus on the prehab side of things now. And also the information is provided in this session is very general. So when we talk about sort of information sharing with prehab, we often start with universal information. And this is really where I'm stepping in today. There will be some targeted information, but there won't be any specialist information. But I really want to share where you can go to get that, because it can be a little bit confusing. And obviously, if you have any change or any new symptoms or concerns, always chat to your team so you can make sure that you've got the right care at the right time. So let's get started. So who am I? And why am I speaking with you today? So this is me at the Royal Surrey in Guildford with my very attractive red uniforms that we used to wear. So I worked at the Royal Surrey on and off for nearly 20 years. I was a pharmacy technician before I studied to be a dietitian. So when I worked in pharmacy, I was actually supporting the clinical trials that were majority oncology clinical trials. And from there, I started to talk to the dietitian. And actually, when I started studying dietetics, it was my dream to support people who were undergoing cancer treatment as a dietitian. And so I managed to have the privilege to do that. Working in the UK, I guess it's fortunate and unfortunate. There was many people that I was supporting through their breast cancer and other cancer treatments. So for many services, there wasn't actually a service available for people who needed to talk to a dietitian who had breast or other, dare I say, common cancers. They were often dietitians that supported people who needed tube feeds and things like that. And there wasn't as many that were supporting people living with breast cancer. So it was about 2015 that I started working with Breast Cancer Now, one of the big UK charities. And from there, sort of my experience and knowledge in supporting people with breast cancer grew. So from there, I was doing a lot of different things and supporting World Cancer Research Fund, which I'll be talking a lot about in some of our other sessions as well, and their evidence to nutrition and how we can build, how we have developed that and then able to share it with you. But the thing that's relevant today is my experience after the NHS. I worked for a digital health company called OncoHealth. They're now called Alvi. And what they do is digital prehab for all patients who they started off supporting people who were about to undergo cancer treatments, but then they've actually branched out to provide prehab advice for many different diseases that they can support. So whilst some of the information is going to be very general today, there are some specifics for breast cancer and preparing for breast cancer treatment. I'm just going to make sure I've said all my pieces on my notes because I don't want to miss anything for you. That was the other thing. So what would you like to learn today? So I am thrilled to be able to have 4 sessions with you. So what I want to do is if there's something that you've came here for today, not only make sure that I'm addressing that today or actually be able to address that in one of my other sessions. So please do add into that Q&A box what you would like to learn today. And the other thing that I want you to think about is if you know which is the protein part of an egg. Is it the yolk or is it the white? And if you were in the room, I would be asking you that personally. But as I know that you're in, hopefully, your relaxing places, have a think about that. And if you know which part is which. So this is what we're here for today. So what is prehab and why is it so important? So one of the charities, I was actually a Macmillan oncology dietitian. Macmillan's a big cancer charity in the UK, and coming with that big sort of influence, they have developed lots of sort of helpful guidelines for health professionals. And the pre-habilitation guidelines were definitely groundbreaking because Rehab has it started in a surgical patient, but what Macmillan were able to do is bring it out to something that's for all patients. So prehab is actually at the start of cancer treatment. So it's actually before cancer treatment, if we can get there. And it involves health optimization that can really help to improve outcomes. And this includes looking at nutritional status, mental health, and long-term health. So the history of it was actually for surgical patients who were having an esophagectomy for esophageal cancer. So this is an 8 to 10 or 12-hour surgery. And what the surgeons were realizing is that if patients were fitter before surgery, they tended to do better post-surgery. So from there was some perioperative, so very immediately around surgery, things that were devised. But then it actually came about that if we can intervene and help to support people earlier and prevent or intervene quicker at the start, it's really going to help improve people's outcomes. So it's definitely a stratified approach. So what it involves is some universal advice. Like I said, I'll be going over through some of that today. But then there's also can be, if needed, some specialist or targeted advice. It moves through things like body composition and improving muscle mass, optimizing protein intake and diet quality. And that's, I'll have a deep dive into that in a little bit. It's about sticking to or encouraging physical activity and exercise guidelines. And I was thrilled to really be able to utilize, to look at Prof. Rob, who came to do a webinar recently. So I'll be leaning on some of his advice. It's a time to talk about alcohol and smoking cessation, stress and distress support, or more broadly, sort of more specialist depression or anxiety support. It can involve more professional advice as well. So it can be a broad team that will deliver a prehab program. So what I like to think of, and I've heard a few professionals working in prehab talk about, is that major surgery for breast cancer or having breast cancer treatment is like running a marathon, and it involves training and support. It's not usually something that you go ahead and do without that support. So what we know is that treatments and surgery can cause catabolism, which is where our body starts to sort of break down if we don't have enough resources and reserves to help our body heal and recover. And that can ultimately impact someone's ability to cope with a treatment or recover well from surgery, might cause worsen fatigue or cause malnutrition, which is obviously a little bit where someone like myself as a dietitian might fit in. So what we also know is that many people now with cancer can be older. They can be a very broad age, definitely, but it can happen more often in someone who is older. They might be more frail or less mobile. People also may have other health conditions that they're trying to juggle alongside having this new diagnosis, and trying to manage that can be really difficult and a challenge. So having these prehab principles where we can get in early and help support this sort of holistic view can really help. And it only needs to be as little as 2 weeks can really start to improve the benefits. So the earlier that we get in, the better. But also these principles are across the board and are applicable at any stage or any phase of treatment. So it's not something that you have to start beforehand. The principles are definitely something that I would say get started as soon as possible, wherever you're at. And this is why. So obviously the benefits to every individual are going to be very different, and how you feel and respond. There's so many different factors that can really impact how someone's going to feel. But there are some common themes that have come out from the evidence that we have listed here. So people spend less time in hospital and they heal faster. They have improved fitness, muscle mass, and functional status. So these are important to, to get on with your daily living, to be able to return to work, to be able to have fun with the family. So whatever those ultimate goals and motivations might be, prehab can have a role in helping you get to that point. I think one of the most interesting things that I found with prehab was its ability to reduce side effects with certain cancer treatments. So the most of my experience was with people on chemotherapy, immunotherapy, radiotherapy, or a combination of those, or longer term hormone therapy. And incorporating the prehab principles can really help people reduce their side effects or cope better with different side effects. It can help them have more treatment and or deal with a longer amount of treatment. So the other thing we know now that we're getting better as such to treating and supporting people with breast cancer, this also means that people are on treatment for longer, or having multiple lines of treatment. So these kind of principles, again, could be starting at a certain time and actually helping to support someone on one of those quite long treatment journeys that can come with certain breast cancer diagnoses. We have also the other thing that I do like to think of is it might be the time where you decide that you do not want smoking or alcohol in your life anymore. It might be that moment where you say, goodbye, I need some help to make a change. And that's really one of the other principles, is that we can talk through some of these things, but it's actually accessing the support to make the changes that you need. This isn't something that you should do all by yourself, because behavior change and some of these different supports are actually, really difficult to have. And reaching out for those right supports is something that means you can get the support you need at this time when you need it to help, again, meet those goals and hopefully have some of these benefits that come with prehabilitation. Obviously, one of the foundation principles of prehab is that prevention and early intervention. So when we think of prevention, it's preventing. So we're preventing body composition changes. But as I'll come to, there might be, different reasons that actually you might feel you've lost weight without trying. And then we're trying to get in early so that we can stop things getting worse rather than the reactive nature that comes with a lot of medical treatments for the majority, or for in the past, I suppose. And unfortunately, it's still the case somewhere. So these are some top tips to incorporate some prehab principles. So this is kind of really practical tips. I'm going to go through each of the different parts of prehab and talk through some specific interventions or ideas, and how you might be able to incorporate it for yourself. So usually a traditional prehab service consists of a multidisciplinary team. It's very dependent on the type of cancer that the service is treating, or if it's very broad. But usually it is very exercise focused. So there's a physiotherapist or an occupational therapist, or more people down that route. There's usually a dietitian. Sometimes there's speech and language services, nursing support, pharmacy, all of these different health professionals that can work together to weave in that support that you might need to help to incorporate these things. But a lot of these services are still in their infancy and not established, especially and unfortunately not in a breast cancer care pathway. So that doesn't mean that we can't access services. And what I'm going to talk through is where we can get that help if you feel that actually, hey, this is something that I feel I want to work on or need some support, that might be a bit ahead of this session that you realise. Lovely. All right, let's get started with nutrition. My bag. So nutrition, to give you some of the background and I guess some of the sort of science or numbers, when we're looking at energy and nutritional requirements for someone who's undergoing breast cancer, they're similar to maybe pre-breast cancer or a control. However, when we unpick this, some people, actually the resting metabolic rate may be increased, but actually many people who get a cancer diagnosis actually move less, which is actually the complete opposite of what we're wanting to achieve. So that's one of the reasons why energy expenditure is often similar to a control. So energy, when I'm talking about that, it's total energy, so total calories from a day or total kilojoules from a day. And other pieces of nutrients can make up that energy. But the thing that I'll be talking about most of the session, and to be honest, is probably the key takeaway from today, is to increase protein. So for pre-cancer, we're looking at 0.6 to 0.7 grams of protein per kilogram per day. This is pretty much doubled when we have a cancer diagnosis. So what we know is that our bodies need more protein. And this phase before we start treatment, or even during, but before we might have any symptoms or nutritional issues, we want to increase our protein. And I'll talk about where we can get that from in a moment. So there is evidence that muscle synthesis isn't blunted or suppressed with people with most cancers, breast included, which means that appropriate intake and activity that will build muscle should induce that muscle synthesis. So which is the process we want. We want to be building muscle in this prehab phase. So for the majority of us, that will mean a balanced diet. And again, I'll talk through the ins and outs of that in a moment. And I've put that as a traditional diet, and you'll see why when I move forward into sort of what a traditional diet is, and then why I like to call it a traditional diet. The other thing, though, might be that in this phase, people need some nutrition support. And by that, it's usually that people are struggling to eat a normal diet. And I'll talk through some questions in a moment that you can think through to see if that might be yourself. In this phase, we're looking for early interventions and to work out why someone might not be eating normally. So these are often called nutrition impact symptoms, and session 2 we'll talk through a lot of those when we're talking about on treatment and eating well during treatment. So these are things like constipation, which can make you feel quite full. Now, the other thing is, you'll probably realise I talk a lot about bowels. Even for breast cancer, I find a lot of people, when they're undergoing breast cancer treatment or about to start having different surgeries, different medications, change in their life that's so big, their bowels can really feel it. And we do know there's a big gut-brain connection. So it's something that I'm really passionate about, supporting people to improve their bowel health for many reasons. And we'll talk about that as these sessions go along as well. One of the other important pieces of advice is that no diet to restrict any nutrients. So not alternative diets, no extreme diets, and making sure your diet is nutritionally complete. And a lot of the questions that I get asked are around different diets that unfortunately often exclude certain nutrients. And whilst there might be theories behind that, and we will have a deep dive into those throughout these webinars, it's the practicalities of it and what it could do when you're on treatment or preparing for treatment. So in the prehab phase, we definitely want you to have a nutritionally complete diet that's got all the little micronutrients that your body needs, but not too much of anything. The one thing we up is protein. And preparing for that means that your body's going to be in the best and fittest way to start and carry on with those treatments. So some people, again, might need some specialist support with things like food boosting or nutritional supplements, and that's where there's a specialist sort of services available. So how do you know what you might need? So most prehab programs will actually combine a screening of some sort to assess the baseline, sort of where you're at. But unless you have access to that, it's sort of asking yourself some questions and then maybe discussing things with your health professionals if needed. So one of the common things is weight changes. So has your weight gone up or down? Have you found that this is something you haven't tried? So it's normally unintentional body changes. Have you found you might have swelling, or difficult putting on jewelry or jewelry falling off you? Those kind of things can be a sign that you're not eating how you normally would, and it might be something that you want to reflect on or ask for some help. If you're having nutrition impact symptoms, you're feeling full quickly, your bowel, you're getting diarrhea or constipation, or you're alternating from both, that can be another sign that you might need some specialist support. Again, if you're eating less, if you're having some problems doing things that you would normally do, these are all things that could have an early intervention that means that they don't develop into things that actually can cause you issues down the line with coping with treatment or something like that. The other thing that I think is really important is if you're stressed about what to eat and worried. So it can be one of the things that I often get asked around people: what should I eat? What can I eat? Or I'm so confused about what I need to eat. And that isn't a nice place to be. Food is so much more than just nutrition. It is the social occasions and its tradition, it's time with families and its celebration. We want nutrition to be a part of that, but actually, these other things that come with food are super important to enhance your quality of life. When we're looking at prehab as part of all of those principles, nutrition is here, but that quality of life is actually another big piece of the puzzle. So we want all of that in that holistic view. So sometimes it might be seeking some support because you're stressed about what you're eating. So that is in itself enough of a reason to be able to access some extra support. So what do I mean if we're looking at a balanced diet and traditional eating? So there's a website called Old Ways, and I really like how they do the food pyramids. And often traditional diets and sort of some of the speaking and messaging that we hear around eating is around the Mediterranean diet. But this is definitely only one area of the world and only one more traditional diet. So there's lots of traditional diets across the world, and they all have very similar properties. So we've got a vegetarian and a vegan diet. We've got a Mediterranean diet. We've got an Asian heritage diet. We have an African heritage and a Latin American heritage here. We have the Aboriginal and Torres Strait Islander Guide to Healthy Eating. So all of these diets have similarities. There's a few differences, but the similarities are really what we're wanting to look at. And we'll have a little bit of a dive into what this means when we're talking about two of the main ones that we probably work to in Australia and in Western Australia. So the Mediterranean diet and the Aboriginal and Torres Strait Islander Guide to Healthy Eating. So we do have a healthy eating plate in Australia as well, but I think the representation of both of these gives us a different view. Everyone's different about how they like to see information, and I think it's helpful that there's different things out there. Also, these sort of food pyramids and plates do get a lot of grief because they're trying to get across very general advice for what is a very broad, we're very different and individual. So what I like to do though is point to these as a base to give us some good ideas. And this is mainly what we're looking for as a traditional diet. It's also bordering on an anti-inflammatory diet, which is a little bit of a what's the word? Almost like a marketing way of putting it. But the good things about these diets are all very similar. So you'll notice one of the main big parts of the pyramid, especially the Mediterranean diet, is plant-based. So whilst plants are a great place to start, you don't need to be exclusively plant-based to meet all your nutritional requirements. In fact, there is evidence that having animal protein before and during cancer treatment is actually recommended if you like animal protein and are happy to eat it, because the proteins are more bioavailable. And actually having animal proteins is a recommended sort of piece of the puzzle when it comes to prehab, which can be a little bit of a surprise to some people. But we'll also talk through sort of diet and eating well after breast cancer. And that's where some of these nuances can really come about as to how things can change moving forward after treatment. So we can definitely chat about that as we go along. So yes, plant-based foods, lots of good fats, good oils, fish oils, omega-3s, or plant-based sources if they're not your thing. Lots of protein in there. And the other thing that I like about, especially the Mediterranean and the way that the Old Ways website deals out and shares these food information, is the importance of being physically active, but sharing your meals with others, which I think is a lovely thing, because food, again, isn't just about nutrition. The other thing that's often kept in the Mediterranean diet is alcohol. Whereas when we're talking about alcohol for anyone with cancer, the recommendation is actually no alcohol. So this is a prime example of where evidence has changed as I've been a dietitian. So we used to recommend the government guidelines for alcohol during a cancer diagnosis. Then we recommended less than 5 units. This is UK version, so I think that's probably less than 2 standard drinks. And then now we actually say no. So there isn't a safe amount. And unfortunately, there's a growing body of evidence on the role of alcohol within cancer. However, we're in a society where alcohol is in a lot of our social situations. So it is a big challenge that we're up against: a health message and then that social message. And whatever that means to you is going to be, again, very individual about how you might be able to implement it in your life. And the other thing is, some people have relied on alcohol for quite some time as a coping mechanism. And sometimes going through a diagnosis of breast cancer might be that time when you do ask for help. And that's what I would always say. There's lots of services out there if you feel that you need some support to reduce or limit your alcohol consumption, which is absolutely what these services are for. So that being said, if you need some help with your eating and drinking, if you want to navigate around this on a more personal level, there are people that you can ask. So an APD, an accredited practicing dietitian like myself, we're few and far between with experience with breast cancer, unfortunately. But for the majority of people who are looking to optimize their health, an APD would be perfect to be able to go through sort of what it means to you. And then I'm actually sure, your the breast care nurses or this support would be able to address the more specific breast cancer requirements that you might have. You can access a chronic disease plan through GP to access certain dietitians, or through insurance, if that's something that you have. Some hospitals do have an oncology dietitian or a general dietitian service that you can be referred to. And if you live in regional or remote West Australia, there is the integrated cancer services. So I've done some work for them, and am their facilitator for some clinical supervision. So they're across the whole of West Australia in WACs, in the regions, who are there to be able to support people living with breast cancer or living with all cancer, but across the whole state. So that's a good service that's come about in the last few years if you're in a regional area. Okay. Quick sip of my water. So, physical activity and exercise. I am not going to go into definitions because Prof. Newton did a great job, and his webinar is available on YouTube and through the website, which is great. So Breast Cancer Care have that up on their website, and I think it's really good to see. He is an amazing academic to be able to have all of those evidence pieces to put together for some really guidelines and where the guidelines have come from for exercise and activity when it comes to breast cancer. Practically is more where I fit in, and I will be able to give sort of universal advice. But what I would suggest is that everyone is different, and we can have different goals as to what's going to be something that we can achieve or we want to work towards and achieve. So, or exercise and physical activity is one of the real foundations for prehab, for many different reasons, but just the way it supports our physical and our mental health. But physically, if we start with the cardiovascular exercise, where we're looking to work towards the arbitrary number of 150 minutes a day, where we're a little bit puffed. I must admit, I'm a bit puffed today. I think it's I'm excited talking to you all. And I've had a bit of a cold. So the physical activity, sort of where we're getting our cardiovascular system working, we know that supports our whole heart and circulation systems. And that is thought to really help to improve specifically, and almost the foundation's been in surgery, but actually the benefits of that are translating into the other systemic or targeted treatments like radiotherapy. So that forms one part. And then the other part is really that sort of weight bearing exercise. So it doesn't mean that you need to be in the gym with the weights. Even body weight, like Pilates and yoga, those kind of things are still going to build muscle. And cardiovascular activity like walking will still build and support your muscles. So everything does fit together, and anything that you can fit in and start with is a bonus. And it does only need to be two weeks that you can really start to feel the benefits that are going to translate into your outcomes. When it comes to the weight bearing exercise, this is where that protein intake is super important. And that's just made me think that I didn't focus enough on it when we're talking about what we're wanting to eat. So I'm going to skip back. So protein foods are fish, seafood, meat, so poultry, red meat. Then we've got cheese, dairy, yogurt. We're also talking about dairy alternatives, specifically soya products. So soya products are very comparable with dairy on the protein front. If you choose to have other dairy alternates, they don't have as much protein in there. So that's fine if you prefer those for all sorts of reasons. You want to have things that you enjoy, but the protein isn't going to be as much. So you need to lean on some of those other sources. And then we've got beans, pulses, lentils. We have, that was one of the reasons I said eggs. So we're looking at egg whites is the high protein, but there's loads of good fats in the yolk. So do keep that in if you enjoy it. Beans, nuts, seeds, and nut butters, those kind of things, they're all going to have the really important protein in there. So definitely dig into those. We're wanting protein ideally 3 times a day. So most of us might eat protein at least once or twice a day, but actually spreading it across the day. So we're having it breakfast, lunch, dinner, if you eat that way, or if you're snacking, making sure you're having at least 3 serves of protein a day. So it's usually a boost for whatever you're having to increase it. Milk as a drink, smoothies with dairy or soya can be another boosting way to add in some more protein. Snacking on nuts, seeds, peanut butter, those kind of things, really good to be able to add in some more things. When we're talking about beans, pulses, lentils, don't need to soak. You can get the ones in tins, that's fine, or you can choose to soak them. Either way, they're still going to have that really important protein in there for you. And I guess, yeah, that's the difference. So adding in that 3 serves a day at least to be able to boost that protein intake for you. And the other reason that I wanted to talk about these different traditional diets, again, skipping back, my apologies, was the fiber that comes in these diets. So having that huge area of fruit, veg, grains, pulses, seeds, nuts, all of those are really fiber rich. So those fibrous foods are really great for our gut health and have the knock-on effect of improving or supporting our immune system. So we're really just starting to understand how this is an important part of healthy eating, making sure we've got a variety of fibrous foods that helps feed our gut bacteria. And doing that early, as early on as we can help support and recover from different treatments. So again, I'll talk about different impacts that can come with treatments in the next session. But overall, more fiber is a good thing. Coming with fiber, we need enough fluids, and that's where water or your milk, other things can be really important to add in to help your gut move through with all that fiber, especially if you haven't had it before, or as much fiber as you might want to explore. The thing is, if you're struggling with your weight or struggling with symptoms, it can be hard to eat certain foods. And again, that's when you might want to lean on some support. But we'll talk on some of those symptoms in the next session. Okay, back to moving. So the two things really go together, and you can see how these sort of these pillars of prehab do definitely merge and are needed, not separately, because there's so much integration in the advice, and independently the moving without the extra protein won't give you as many benefits. So having the extra protein and supporting your gut health with that nutrition can really help make it easier to move. The other thing that happens is if you're not eating enough energy to meet your requirements, it's hard to move. So you need to make sure that you're eating enough. For many of us, it might be something that we may never have or not have done. And then moving into other symptoms, if we're struggling with our mood, struggling with our sleep or our mental health, that can impact on our eating as well. If we're not eating enough energy, we can really struggle with our moving. So again, it's all linked in. And I'm not going to go into too much detail on that moving, but it is the core principle when it comes to prehab. If you're struggling to move, or you're not sure, or you have maybe a restriction that means that you need to ask for some help, exercise physiologists are specifically trained, and most of them will have experience working with people who are preparing or recovering from cancer treatments. Physiotherapists can be varied, so do ask about their qualifications and training as to how they feel. If they're confident to support someone, they'll definitely have experience, obviously, in certain specialities, like we all do. Your GP can often refer you for a chronic care plan if you need it. And there is lots of resources out there, again, that you can lean on through our website or through COSA, so Clinical Oncology. They have information on there, moving through cancer fact sheets. So there's lots of different things that you can lean on, and definitely reach out. I'll put my details at the end if there's anything that you struggle with, because I can usually find something that might be able to support you. So another pillar of prehab is the mental and psychosocial health. And I kind of alluded to it when we're talking about it with eating and with moving, that if we're struggling with our mental health, it can actually be really hard to eat well. It can be hard to go out shopping for yourself. It can be hard to choose foods that might be the certain requirements that you need. Often when we're feeling really tired, we might pull something really energy rich, and that might be not what we're wanting to do. So actually starting as a foundation with mental or psychosocial health might be where you end up starting when it comes to the prehab pillars, because focusing on here will have the knock-on effect of making eating or moving or both that bit easier. As part of prehab, being able to have a conversation with a supportive professional or friend, depending on what you're needing, to go through things like how stressed or worried you might be, if you're feeling anxious, if you're feeling lonely or scared, making sure that you've got that supportive network around you to support your mental health is very important as a part of prehab and beyond. Obviously, I hope that everyone is aware of just the importance of those things. But it is an important part to address, I think, with prehab, as often the knock-on effect on optimizing your health might not be really considered by some people. Obviously, a new diagnosis can really make people feel concerned or worried, and leaning on support for whatever you might find you feel you need support is important. So this could be reaching out to someone for some daily support. It might be linking in with community to find some joy in a different way through some different experiences. It might be improving or asking for some help with some family relationships. Managing money and work can be a huge part of our how we feel mentally and psychologically, and that might be something that you need some support with, especially with a new or ongoing diagnosis. Some things around drugs and alcohol, or misuse around drugs and alcohol, can actually, again, either be caused by or be causing mental health issues that you need some support with. Yeah, there's obviously lots of different things, and I definitely think having this in the prehab sort of pillars is a super important thing to address, as it can have a huge role in an impact on us as we might prepare for cancer treatment. If you're struggling and you're not finding the sort of general support is enough, it is something to definitely reach out to your GP or your doctor about, whether it's another chronic disease health plan, a referral to a psychologist, mental health plan, those kind of things that can really give you access to those services. There is counselling available as well if you need it. So those services are really important to be able to help you maybe deliver on something else that you want to in your life. So don't let it, or just reach out, I think is the tip there for support if you need it. And I think that goes the same for other lifestyle components when we're talking. Again, I know I've mentioned these in other sections because nothing is really in isolation. Alcohol, drugs, smoking, but sleep, that's another one. So I think I mentioned before, if you're tired, it can be a huge struggle to get out and feel like going to the gym, especially if it's not your thing. So sometimes sleep would be the first thing that I might start supporting and chatting someone through some general sleep hygiene advice. Again, there is services out there and support if you need it, because that sort of rest and sleep for your body is super important to not only your mental health, but it helps your body. That's where it lays down that new muscle from all the protein that you're eating and all the moving that you're doing. So that sleep cycle is super important as well to make sure we're getting enough. Now, the other thing is, I've pretty much told you every single thing that you could do. So what is super important is actually to break it down and prioritize, because if you end up taking on too much, you can end up being overwhelmed and burnout, which is the complete opposite of what we're here for today. We're really here is to focus in on maybe one or two of these many things that I've talked about and be able to start there. And from there, once you've cracked them, you can move on to something else. Or if you realize, actually, I need some help, that's when you put your hand up and get some help. So I've gone through a whistle-stop tour of prehab and all of the principles and suggested interventions. So you have a think and reflect on where you might want to get started, because that's what's really important. Focusing on you and working out where you might need some support. And yeah, don't try it all at once. So now what I wanted to do was talk through some fact or fiction. So I'm going to do this at the end of every session. And I'm trying to use some of the pre-asked questions, but keep things to be relevant to the session that I've got. So the first one that I've put on is fact or fiction, and I would ask you if you're in the room, I need to become vegan to prepare for my treatment. Hopefully, I have answered that question for you, that you don't need to be vegan before your treatment, unless you choose to. If you want to, you can have a really nutritious and nourishing diet, vegan or vegetarian diet. Takes a bit of planning, a bit more planning than it might have before, but you can definitely meet all your needs if that's the way that you choose to eat. Um, However, it's not something that you need to go down unless you want to. So again, there is some evidence on the animal proteins being an easy way for your body to utilize protein and amino acids. But if you're on a vegan diet, your body will still be doing the same thing as long as you're getting all those amino acids in. It's just a little bit harder. So whilst you might choose to become a vegan, it's not something that you have to. Many people choose to be vegan for many different reasons, and it's definitely something that we can support. And you can get everything that you need to cope with and push on through treatment for sure, but it's not a requirement for you if that's something that you're concerned about. So this I know came up in another webinar, but I wanted to make sure we talked about it at this phase as well. So you or I am overweight, I need to lose weight, or do I need to lose weight before I start my cancer treatment? So I deliberately left off all of the numbers on this BMI rainbow, because BMI and weight and the way that we report on weight is not individual. It isn't an indicator of our health. And it is usually very unhelpful in these situations to start to measure your health on a number, whether it is someone saying you're overweight, or some of the other terms that are used to describe higher weight people. So what the important thing is that we increase muscle mass, which can have weight changes. But I always tell people, especially preparing for treatment, that if you go on any restrictive issues, you run the risk of not building muscle and actually ending up with malnutrition or a micronutrient deficiency. So it's not something you need to do. It's the same advice, generally, whatever size you are. And actually, at any size, people can have malnutrition. So we would look at what you're eating if you've had any unintentional weight change at any size. So these are things that would highlight an actual need for nutrition support advice. And it's still very typical for us to help boost a high protein diet for anyone of any size, especially about to start treatment. So no, you do not need to lose weight. Many of us as well find we might have had specific food issues throughout our lives. An eating disorder is all too common, or as is disordered eating. And having a diagnosis of breast cancer thrown at us can actually mean we fall back on some of those different behaviors that we may have relied on to cope in the past. And that again can lead us with not getting that nutritionally complete diet. So it's trying to be as nutritionally complete as you can, boosting your muscles and working towards that sort of overall health optimization through this stage. So please do ask any questions if you have any on that. So I'm often asked that there are certain foods that I must avoid. So when it comes to breast cancer, the main foods that we would avoid or suggest we work to minimize are processed meats and alcohol. So they're the two. Obviously, the other foods that you should avoid are things that you're allergic to and things that you don't like. So other than that, there isn't other foods that you need to avoid, or unless they're recommended by your doctor, obviously, depending on certain medications that you might be on. But when it comes to sort of this stage, we're wanting to minimize processed meats and minimize alcohol. And so that's pretty much it. There isn't foods that you need to avoid or not, as the case may be. So that was my whistle-stop tour through through prehab and some fact or fiction. So what I'm really happy to do is take some questions, and obviously stay tuned for the next session, which is eating well during breast cancer treatment. That I would need Chandrika to remind me of the date. Thank you.
So what I said when I was on mute, I thought I pressed it, but anyway, is that you answered quite a few of the questions in your fact or fiction section.
Cool.
Angela had asked you about vegan diets, and she had a follow-up question about vegan calcium sources and bone health.
Cool. Yeah, that's a good one. Vegan calcium sources. So your alternate dairy products should be fortified with calcium, but not all of them are. So it's checking labels to make sure that there's calcium in there. And because the calcium's added, make sure you give them a good shake, because often you can literally, the calcium is on the bottom of the bottle. So making sure if you're having any of those that they've got calcium added, and yeah, give it a good shake. Nuts, seeds will have some calcium as well, as does some vegetables. So having a variety of things. But calcium, actually, if you're worried that you're not eating enough, is something that you might want to discuss a supplement for, or have a nutritional assessment to make sure. So it is something that is more challenging with a vegan diet. If you, what I could do, Chandrika, or share, the British Dietetic Association do some really good sort of calcium leaflets, and the good thing is they've got those sort of vegetarian and vegan sources in there. So I can share the link after. Because I haven't found a resource over here that I'd use as much, but it's just something that means you can get a variety of things. So it is a bit more challenging, but lots of things are fortified now with calcium, which is a good thing.
Fantastic. So when you say alternate milk products, you're talking about soy milk. Predominantly, you said that's the best equivalent to dairy?
It's the best equivalent to dairy for protein, but
Mhm.
it depends on what you're choosing to eat it for. So not everyone likes the taste of soya. So you don't want to, have soya because you think it's better, but then you only want to have a sip of it because you don't like the taste. So if you like rice milk, as long as it's fortified with calcium, but then you choose other protein foods for your protein sources, then that's fine. So it's that combination, that means whatever you choose, for whatever reason, just making sure you're replacing something somewhere else.
What about almond milk? Is that better for the protein?
No, it doesn't have much protein in it. I think there might be a new brand that's come out where they've fortified it with protein to try and match. So that's the other thing. Food manufacturers are starting to cotton on to the fact that people want protein in their milk supplements, or milk alternates. So there are some new products coming out all the time with different compositions, but I'd always check your labels for that reason.
Okay, fantastic. You answered very clearly what to avoid. That was one of the early questions that came through.
Yeah.
So can you explain more about what processed meat is?
Yeah. So processed meat is things like um, sort of anything that's been manipulated and generally got added salt or sugar or things like that. So salamis, we've got, I've forgotten almost all processed meats. Sausages usually have additions in there. Ham is on that list, unfortunately. I love ham. Um, anything. So if you've got a hamburger that you're making yourself, or that has been is a fresh hamburger that doesn't have additives in it, then it's okay. So part of the problem is that the meat has been kept for a while, and it's usually got additives to it or nitrites, and actually that's the problem. So it's not the meat in itself. There is some evidence on large amounts of red meat affecting bowel cancer risk. So there is that evidence as well, but most of it is around the processed nature of the meat. So that's sort of the avoidance. But even then, if I had someone struggling to eat anything, and they were undergoing treatment and it was a short-term calorie and protein boost, then I would suggest that they could eat meat, processed meat. So it's still nuanced with those decisions about what you might choose to eat and why.
Yeah, so it sounds
Yeah.
like the focus is more like get your nutrients in however you can get them in, especially if you're not feeling 100%,
Mm.
but there are optimal sources of those nutrients.
Exactly, definitely. And I think when we talk through more eating after breast cancer, moving into sort of where you might want to be preventing a secondary diagnosis or a recurrence, the advice gets a little bit more nuanced in a different way, where I might be, again, not avoid, but reduce those kind of things more. So it's not as clear cut as some of the messaging might be.
Yes, I
Yeah,
think people want that black and white, like give me a list of do's and don'ts, but
I
nutrition
know.
is quite nuanced, isn't it?
It's very nuanced, and the evidence changes as well. I think that's important. Like, there's things that have changed whilst I've been a dietitian, like the advice around alcohol, and so things do change as we go through gathering the evidence and studying these things. And even then, it isn't a guarantee. And when I talk through some of the stats in another session, it's just there's different statistics in different ways. And it's making a choice that's personal for you and what you're comfortable eating and not stressed eating, and still meeting your needs and enjoying food. I think that's the message I like to get across.
Yeah, I agree. It's not meant to be punitive, is it? It's meant to
Yes,
be part of our pleasure and happiness as well as
exactly.
feeding our body well.
Yeah.
With that in mind, you sort of touched on this with the stress conversation,
Mhm.
but a lot of people do feel a craving for sweet treats.
Mhm.
And Angela did ask you about whether sugar feeds cancer. Can you speak to that a little bit, please?
I'll speak a little bit to it, but I'm actually going to do more of it in the next session, definitely, because it actually is probably the most common question that I get asked. And I like to do a bit of a deep dive into where that came from, why it's still so questioned, and why there isn't a simple answer, because sugar is something that all our cells need in our body. And unfortunately, cutting it from your diet will not mean that it's reduced, that it disappears in your body. So your body's very good at producing its own sugar. Your liver has a huge store of sugar, as do your muscles. Keep a body of sugar in there. So unfortunately, trying to reduce or avoid sugar usually leads to lots of complications with what are you going to eat. And my issue is that um, most plant-based foods that have sugar in there have huge amounts of fiber, and we know the benefits of fiber. So it isn't something that I want people to be scared of having in their diet. The other thing is that if you're reaching for sugary foods, if it's something that you don't want to eat, so sometimes, before I did this call, I ate some caramel because I wanted to have energy to get through the call. I wanted to eat that. But if you're eating something and you're not wanting to, then it's trying to work out why and taking a few steps back, maybe looking, did you eat enough at the meal before? Are you in a hurry? Did you sleep enough? Those kind of things are usually why we're making decisions that we might not want to make, rather than it actually being the food that we're picking up, if that makes sense.
Mhm. I noticed I picked up on you said have the protein 3 times a day. Is that to help with the glycemic index, the glycemic load across the day?
So it does help with that, but actually, no, it's just to get it in, because most of us eat twice a day. And actually, as we get older, I come across a lot of people that only have protein once a day, like a main protein source at their main meal. But actually, to meet those higher protein requirements, it needs to be, you know, 2, 3, 4 times a day having protein in. So three, having something with every meal is kind of a nice place to start to show that you're going to be boosting your protein.
Okay, fantastic. I think we've answered all Angela's questions. She asked quite a
Excellent.
few.
Cool.
Catherine's question about taste changes, I'm guessing you're going to respond to that in the session, which is June 5th, by the way, our
June 5th,
next
thank you.
nutrition session, which is focused on during treatment.
So
Is that right?
what did she say? What did she
Uh,
ask? Because I'd hate to
she
leave her in the lurch for a
said
month.
that she's wondering about taste changes and if there's anything that is recommended for taste changes.
So taste changes is one of the highly reported issues when it comes to cancer treatments, but it's one of the least things that we have treatment for. But that being said, there's been a better investigation over things. So I will definitely touch on it in the next session. But in the meantime, um, enough hydration is really important for taste changes. Getting someone to check that you don't have oral thrush, depending on where you are in your treatment. Um, the other thing is exploring other flavors of food that you might not have had before. So I did some work with a charity in the UK called Life Kitchen, and he was a chef, and he was doing a lot on taste changes and talking through the different flavors of food. So actually, if you're favoring, sometimes you can't handle meat or something like that. So it's actually okay if you have soft, sweet foods all the time while you're managing through those taste changes. They're usually transient, and it's just getting in that nutrition while you can, but also exploring other flavors. So some people go up a curry flavor or down. So don't be afraid. We're kind of creatures of habit, and we'll often eat what we are used to eating rather than what our body might be able to tolerate a bit better during treatment.
Mhm, mhm.
Yeah.
Another question that came through in the chat was around supplements, and you have mentioned a couple of possible scenarios where a health professional might prescribe
Mhm.
supplements. Can you talk more about supplementation? Is there any risk? Can people self-prescribe?
Yeah, so supplements is a broad term, and I think there's almost two different things that I would work with people. So people might need a supplement that meets their macronutrients, so it might meet their protein energy needs or both. And there is different reasons why someone might take a protein supplement. So even today, if you realized actually I'm going to struggle to meet my protein needs, there isn't any reason you couldn't explore a protein supplement in a drink if it works for you and it's convenient and you like it. That works for some people. Again, those things are something that you could explore yourself. If someone's struggling and not eating or meeting their requirements, you can get prescribable nutrition macro supplements as such, and some people do need those. So that's sort of where we fit with the macro. But often when people are talking about supplements, they're talking about the micro supplements, like things like a multivitamin and mineral, and those kind of things. So as a general rule, I usually say speak to your health professional about them. There's so many different types of supplements out there, and they're not regulated in the same way that a medication is. So it can be concerning. They can interact with different parts of your treatment. Even some of the more common supplements like vitamin C, there was a trial done in lung cancer patients, and it actually stimulated things rather than the other way around. So they're definitely used in trials, and they're still investigating how they might be used. And there are some sort of vitamins that are used alongside treatment. Vitamin B6 can be used for sore hands and feet. That's the pyridoxine that people take with certain medications, but it's a little bit scary to start adding them in too much when you might just be trying to increase your need. Most oncologists I've worked with are happy with a general multivitamin and mineral to get a little bit of everything without too much of anything. But it's always chatting it through with your team that know what treatments you're on. The other people that I rely on is a pharmacist. So they're really helpful at being able to know what medications you're on and what risks there might be for you. But I'm very pragmatic to talk through individual cases with people because, it's something that you might want to understand what the risks are. And that's definitely something that I've talked through with people so that we can have that open dialogue about why you want to try something, what you think the benefits are. And then if there are risks, we can share them. Also, if there's something else that I could suggest that's food that might deliver a similar benefit, then I can also say that too. So it's not as easy as yes or no.
It never is.
It never is. No.
There's another question here about the best way to get the most nutrient value out of your food when it comes to cooking styles. For
Yeah.
example, is it better to steam or is it better to eat things raw? What kind of cooking styles will optimize nutrition?
So some nutrients are released better cooked and some are better raw. So I usually, surprise, surprise, say have a variety. Um, so again, it depends on I'm more practical that if you like raw foods and you're going to enjoy them and eat them better, then have more raw foods. But if you like cooked foods, then have more of those. It's also dependent on the weather, how you're feeling on the day. So we don't lean towards you need to have raw food or you need to have cooked food. It's more of that variety as long as it's safe, because actually that's something I haven't talked about. But I'll talk more about next session, is food safety is super important when we're having treatment. And actually that might be the deciding factor when it comes to whether you cook something or have it raw.
Yeah, I think you're getting about like neutropenia. Is that what you're
Yeah,
leaning
so
into? Yeah.
yeah, but actually any food safety with a lot of cancer treatments is important to make sure we're having food in date. And again, some of those messages are, we're being pushed in a different way when we're looking at, food waste and things like that in some of our messaging. But when we're having a cancer treatment, we're wanting to be more food safe. So we might do something that we wouldn't do normally, where we might eat out of date yogurt, whereas if you're me, but actually when you're having treatment, that's not a great idea. So yeah, again, it's another little bit of a wobble issue.
Okay, that's good thinking there. I've got another question. This is coming from me personally. So if you're not prepared for this one, Adele, you can save it for next
I'll tell you
time.
off after.
Sorry. But I noted you focused in on fiber, and I think that's, great if we're getting that variety of fruit and vegetables and whole grains for gut health.
Yeah.
And you touched very briefly on that might improve your immune system. That sparked a thought in my mind about preparation in prehab, whether it's beneficial for people then to really focus on, prebiotics and probiotics, whether from food or supplements.
So good idea, good question, and I can answer it now. Phew. Um, for most people, it is a good idea, who are have good bowel function and can tolerate fibers really well. So boosting all a variety of fibers. A lot of those fibers act as a prebiotic, which means it feeds gut bacteria. A probiotic isn't as evidence-based in that setting, only because we can't tell yet which strains are going to work for you. So it's still a little bit too individual, but pre-treatment, it is safe to have a probiotic. Most prebiotic supplements are just a fiber supplement anyway. So if that's something that you did want to explore. The thing that happens with probiotics is, though, that there was another surprising study in immunotherapy patients where they had prebiotics. They had a fiber healthy eating group and a fiber healthy eating plus probiotic group, and actually it decreased the response of the immunotherapy. So during treatment, again, it's gone down that supplement route where we're not sure. Have a chat with your treatment, whoever's treating you, to see if it's something that they would recommend. So it is, again, that food first fiber boost, but pre-treatment it is safe. You could have some benefits, but we're still exploring what they are exactly. But if you're having prebiotics, you still need the fiber in the long run to feed those bacteria that you're introducing. So and
What
that's
about
just
the
made.
real food
Sorry.
probiotics, like the kimchi and the
Yeah,
sauerkraut? Are they
definitely.
helpful?
Yeah, definitely. And yes, I did forget those. So all of those are great, actually. Again, they're safe during treatment too, unless there's sort of an infection risk with neutropenia, those kind of things. They're still a little bit on the fence, and it's always something that I suggest you ask your doctor how they feel about that. But pre-treatment, definitely dig in. They're going to really help provide pre and probiotics, and that sort of fermentation for the gut, that we are only realizing the benefits of it now to prepare. But that was what I was going to say. Some people have some issues tolerating certain fibers. So if you have a diagnosis of IBS, it might be a time to lean on your health professional to help you navigate around increasing fibers to things that you do tolerate.
Mhm,
Yeah.
mhm. Okay. Look, I'm just circling back to make sure that we'd covered everyone's questions, and we
Cool.
may not have fully answered Emily's.
Mhm.
Emily says she's trying to lose weight post-treatment. So again, you
Yep.
might put this into a future webinar, but nothing's budging. She's got body composition scales and nothing's changing. And she thinks her diet and exercise are pretty good.
Mhm.
So could that be what could be going on there for Emily? Can you talk about
So
that?
yeah, I will talk about that definitely. So what I would like to say is that everybody is different, and our bodies do have a certain way of being the body they need to be, that's they're programmed to be. So whatever your body size is, there's a definite spectrum across of people, which can be a challenge when we're looking to sort of some of the society norms that say we should be in a smaller body. So it sounds like you're working at really improving, I think, well, without putting words in your mouth, I'm sure the what you're hoping to achieve through weight loss is some health sort of improvement. And that can actually come in despite without any weight movement. So inside our bodies do change. And as long as you're getting a nutritionally complete diet, your body's getting everything that it needs. And it might be sort of the new normal. You did say, I can see a question here that some things happen during treatment, and that's very true. The cycle of treatments and medications can mean that our body just stays put for safety, and it is just making sure you get your body through and then see on the other side what that might be and where you might want to move to next. So I think make sure you're being kind to your body and eating well and enjoying your food, and hopefully it's helping you cope with treatment rather than being more of a stress during treatment.
Mm-hmm. Mm-hmm. Emily's added to her question that she's aiming to lose weight pre-surgery. So it is a prehab situation.
Mhm.
Is it just as good to improve your body composition, or are surgeons going to say, no, it's about kilograms?
So surgeons might say it's about kilograms, but I am big on that it's about body composition. So one of my biggest sort of fears is that why would we want to cause malnutrition? So if someone needs to literally starve themselves before surgery, so it might bodies are very clever and they won't always just reduce weight because we reduce calories. So there's other things that are happening inside, and you could do everything right to lose weight, but you still might not. And what we're actually, and it's, I would often work with a surgeon to help them understand the risks of malnutrition and how that can impact surgery over what the number moving down a scale might do. It's difficult because then you've got this message from the surgeon saying you've got to lose weight, but if your body just won't budge, it's not you. It's not something that you've got that extra control over. And what you're not wanting to do is become and lose muscle mass when you're working so hard to keep it. So yeah, it's a really difficult scenario, that one.
It is. So, what I'm taking away from our session today is we need to keep moving in
Yeah.
lots of different ways.
Yep.
Building muscle is really helpful. Managing our stress is going to help with our behaviors, and eating a wide variety of mostly whole foods, lots of plants, but not strictly only plants. Could be some animal protein there as
Yep.
well.
Yeah.
Yeah,
Yeah.
fantastic.
Great. Lovely. Well, I look forward to the next session and any other questions that crop through. I still have a nice long list, especially about some specific diets that I will do a bit of a deep dive into as well. But hopefully everyone comes out with something new that they've learnt.
That's so great. Thank you so much for your time today, Adele. I
Absolutely.
will just let everyone listening know that they can, of course, touch base with the counsellors and the nurses here at Breast Cancer Care WA, and also that we do have a second nutrition webinar coming up, which is focused more on the time during treatments. That's June the 5th at 2 p.m. with Adele. We've also got one on sleep coming up in June with Professor Josh Wiley. So all of these things, as you said, they do intersect and overlap, and they're all really important for our well-being. So we really appreciate your time, your energy, and your fantastic knowledge. Thank you so
Okay.
much.
Thank you all. Thanks so much for coming along. I'll see you soon.
See ya.